All right, open enrollment is coming up, and it can be a very confusing process.
Yes, we're joined by Marla Pantano, the president of Care Partners of Connecticut, and we're talking about Medicare's open enrollment. Thank you for being with us.
Yeah, we're talking more specifically how to sign up for Medicare plan during the upcoming annual enrollment period, and I think this is very, very interesting. Thank you so much for being with us.
Thanks so much for having me. Great to see you all.
All right, so what is the Medicare annual enrollment period? Let's start with that.
Sure. The Medicare annual enrollment period, often it's referred to as AEP for short, is the time when those who are eligible for Medicare can make changes to their plan. There are several things they can do during that period. They can either switch to a new Medicare Advantage plan. If they're already on just traditional Medicare with Medicare Supplement, they can move to a Medicare Advantage plan, or they may be able to actually remove or add prescription drug. Those are a few examples.
Okay.
Yeah, and what do you think is kind of the most important thing to make sure you're taking advantage of what you need to take advantage of?
All right, yeah. AEP is really the annual time when people can make a change, and they want to find a plan that really fits their needs. That can be a change to your monthly premium. There are premium plans on Medicare Advantage that are $0. You can lower your co-payments if that's important to you. You can ensure that you get maximum financial security by looking for a plan that has very low maximum out of pocket. That's the maximum amount in any 1 year that you'll have to pay out of your own savings. Or you can actually find ones that have additional benefits that are not normally covered by traditional Medicare, such as dental, which is often very important to people.
All right, and how long does the AEP last, Marla?
Yeah, so AEP, again, is just once a year, so it's your one time, and it begins on October 15th and runs through December 7th.
Okay.
So that's when you can make changes to your plan, and they go into effect on January 1st.
And what happens if you, on December 8th, you realize, uh-oh, what happens?
Well, you're normally then in the plan that you had previously. Often you roll over, that you keep the same plan that you chose the prior year. That's traditionally how it works.
Yeah, and this can be very confusing and kind of overwhelming for folks, but you have experts like specialists who really can help and maybe take a look at what your most important needs are and help you pick the right plans.
That's right, Kara. At Care Partners of Connecticut, we really want to make sure that people get the plan that best fits their needs. So that's really important. So we actually have local licensed Medicare Advantage agents that are available to answer any of your questions. And folks can get that information by calling us at 844-388-6589, or they can also visit us at carepartnersct.com. In addition, if you want to talk to a local licensed insurance broker agent, they will be able to help you with your needs. Or you can also go online, and the government also provides a website that gives great information called medicare.gov.
And tell us a little bit about Care Partners of Connecticut. It's actually a joint venture. Is that right?
You're right. Thanks, Scott. Yes, we are a relatively new plan. We are a joint venture between Hartford Healthcare and Tufts Health Plan from Massachusetts, which Tufts Health Plan actually has a 5-star rating, which is one of the important things to note too, that plans have different star ratings by the government, which really tells you how strong their customer service and quality is. We're proud to say that in addition to having that partnership, we at Care Partners Connecticut just received our 1-star rating at 4.5 stars.
Wow,
so
that's impressive.
We're really at the top of the very first time. We're really excited based on this partnership.
Okay. And how do you know where to look for the stars? If we're helping our parents or something like that, how do you know where the stars are?
Sure. Actually, what I mentioned earlier, medicare.gov, that resource, if you go there and you go and search for a plan, they'll list the star ratings for you, so you can see them right there.
You should check that out.
All right, Marla, once again, before we go, give us those important dates again so we can drive it home.
Sure. It starts on October 15th when you can make the changes, and it runs through December 7th. Try to make sure you calendar that and get the changes done.
Okay. Thank you so much for being with us today. We so appreciate it.
And you've got
Thank you so much.
Got a phone number up there, 1-844-388-6589. You can call them and their specialist will help.
I think that's terrific.
Yeah.
The more help, the better, especially when it comes to that.